Sometimes history takes its most fascinating turns not through deliberate design, but through accidents, missteps, and unexpected outcomes. The story of a little blue pill that became one of the most recognized medical products in the world is not a tale of scientists setting out to change intimacy, relationships, and cultural conversations. It is the story of a surprising mishap, a failed expectation, and the astonishing way that human curiosity can transform failure into groundbreaking discovery. Picture the world of medical research decades ago. Laboratories buzzed with ambition. Pharmaceutical companies were pouring countless resources into finding solutions for diseases that plagued millions. Among them was one of the deadliest and most feared conditions, heart disease. The heart, after all, is the engine of life, and for centuries humanity has sought to keep it beating stronger and longer. Researchers were determined to create a medicine that could expand blood vessels, ease pressure on the heart, and ultimately reduce the devastating toll of chest pain, angina, and cardiovascular strain. It was within this noble pursuit that the seeds of an entirely different revolution were accidentally planted. In the beginning, the new compound seemed promising. Early chemical models suggested that it could dilate blood vessels effectively, improving circulation and relieving pressure in a way that other medications could not. Trials began with high hopes. Volunteers suffering from heart conditions were given the experimental drug, and researchers monitored their vitals closely, looking for improvements in chest pain, exercise capacity, and overall cardiac function. But as the days and weeks passed, the results were not lining up with expectations. The supposed miracle compound was proving to be underwhelming in its intended purpose. Chest pain was not decreasing significantly. Heart health outcomes were not improving the way the scientists had envisioned. From the perspective of medical research, this looked like another dead end. Countless drugs begin in hope but end in disappointment. Millions of dollars and years of work can vanish into nothingness when the body refuses to respond as theory suggests. But in this case, something unusual caught the researchers' attention. Though the volunteers were not reporting great relief for their chest pain, they were whispering about something else. Some were hesitant at first, embarrassed to mention it in the sterile, clinical environment of a medical trial. But slowly, the pattern became undeniable. Men were returning their pill bottles with sheepish smiles, and the staff noticed that many of them were unwilling to give back unused doses when the trial concluded. What was going on? The supposed heart drug was not working as intended, yet participants seemed strangely enthusiastic about continuing it. Soon, the side effect was openly acknowledged. The drug was consistently producing a marked improvement in another very personal area of health. An unintended outcome, but one that caught the attention of every scientist involved. This was no minor detail. For centuries, cultures across the world had grappled with the reality of intimacy challenges. Ancient remedies, rituals, and potions filled traditional medicine texts, from herbs in Asia to concoctions in Africa and tonics in Europe. Yet none of them had ever achieved the reliability or scientific backing of modern pharmacology. Suddenly, by accident, a lab dedicated to cardiovascular treatment had stumbled onto a potential solution to one of the oldest and most private struggles of humankind. At first, the reaction was mixed. Some scientists considered this outcome little more than a distraction from the original mission. After all, the goal had been to fight heart disease, a leading killer, not to explore matters of bedroom performance. But others saw possibility. They recognized that intimacy is not just a luxury, it is a cornerstone of mental health, confidence, and relational stability. Problems in this area can erode marriages, fuel loneliness, and contribute to depression. If a reliable medication could truly address such an issue, it could transform lives in a way that extended beyond the physical to the emotional and psychological. The next step was rigorous testing. Could this drug, originally intended for the heart, be repurposed and refined for this new use? Clinical trials began in earnest, this time not with chest pain as the focal point, but with intimate function as the measured outcome. And the results were astonishing. Time and again, men reported success. The medication was not only effective, but consistent, reproducible, and safe enough under controlled dosage. What had begun as a failed attempt at a heart drug was rapidly becoming one of the most revolutionary breakthroughs in sexual health. When the pill was finally released to the public, it did more than treat a condition. It sparked a cultural phenomenon. The world took notice almost instantly. Media outlets covered it with fascination, often with humor and curiosity, but beneath the jokes lay a recognition that this discovery was profoundly changing the landscape of medicine. For the first time, millions of men had access to a scientifically validated, dependable way to address a condition that had previously been shrouded in shame and silence. The impact extended beyond medicine into relationships. Couples found renewed confidence and connection, marriages rekindled. Men who had once withdrawn into themselves out of embarrassment discovered new vitality. And beyond the personal sphere, the discovery ignited wider discussions about aging, masculinity, and the right to seek fulfillment at every stage of life. But the story does not end there. The accidental discovery of this little pill also had ripple effects across the pharmaceutical industry. It reminded researchers of an invaluable lesson. Failure is not the end. What looks like wasted effort may, in fact, conceal hidden treasures. A drug that misses its target in one area might reveal an unforeseen benefit in another. This principle has since guided countless explorations, encouraging scientists to look closely at side effects, anomalies, and unexpected data instead of dismissing them outright. Serendipity, after all, has been a silent partner in many of history's greatest innovations. Consider the broader philosophical implications. How many other discoveries in human history were born not of careful intention, but of accidents? Penicillin emerged when a petri dish was left unwashed. X-rays were uncovered while experimenting with cathode rays. Microwave ovens were born when radar equipment accidentally melted a candy bar in a scientist's pocket. Again and again, progress has hinged not just on intelligence, but on the willingness to see opportunity in mishap. Viagra's story stands proudly within that lineage, a moment when failure became triumph simply because sharp minds paid attention to what was not expected. The pill also sparked important debates. With widespread use came ethical questions. Should a drug designed for intimacy be marketed so openly? Would it be abused? Could it create dependency or unrealistic expectations? Critics wondered if it might shift societal views of aging and masculinity in unhealthy ways. Yet, over time, the medical consensus held firm. When prescribed responsibly, the benefits outweighed the risks. It was not merely a lifestyle drug. It was a legitimate treatment for a legitimate condition, providing relief and confidence to those who had quietly suffered for too long. Financially, the discovery also marked a turning point. The pill generated billions in revenue, catapulting its manufacturers into unprecedented profitability. Competitors rushed to develop alternatives, sparking an entirely new category of pharmaceuticals. The marketplace exploded, but behind the financial headlines lay the deeper truth. Millions of lives were being tangibly improved. Even more intriguing, the research around this accidental discovery opened doors into new scientific frontiers. The role of nitric oxide in the body became a major area of exploration as researchers sought to understand more deeply how blood vessels relax and expand. This knowledge spilled over into cardiovascular research, pulmonary conditions, and other areas where vascular health is crucial. Thus, the pill not only changed intimate health, but also expanded medical understanding in ways that benefited a wide range of conditions. For society at large, the discovery also peeled back layers of stigma. Talking about intimacy challenges had long been considered taboo, especially among older men. The arrival of a simple, reliable pill forced those conversations into the open. Doctors could discuss it openly with patients. Men could acknowledge their struggles without shame. Comedians joked about it, but behind the humor was a subtle cultural shift. Society began to accept that intimacy is an essential part of human well-being, not a frivolous indulgence. The story, at its core, is not about chemistry alone. It is about the human journey, our relentless pursuit of solutions, our capacity to learn from failure, and our ability to see value where none was intended. A mishap became a miracle because curious minds refused to overlook what others might dismiss. And in that moment of openness, millions found new hope. The little blue pill became a symbol of resilience, of second chances, of unexpected victories. It reminded the world that progress is rarely a straight line. We aim for one target and sometimes hit another. We set out to solve one problem and stumble upon a solution to another, equally pressing one. In the end, what matters is not that the original plan succeeded, but that humanity advanced nonetheless. If there is a lesson to be drawn from this tale, it is that failure is not final. What appears to be a dead end may simply be a detour towards something greater. The scientists who pursued a heart medication did not achieve their initial goal, but they achieved something extraordinary nonetheless. Their willingness to embrace the unexpected transformed lives in ways they could never have imagined. This is the surprising mishap that led to one of the most remarkable discoveries of modern medicine, a failed heart drug that turned into a global phenomenon, a side effect that became the main event. A moment of failure that birthed triumph, not what anyone expected, not what anyone imagined, redefined as opportunity. This truth is woven into the history of human advancement more deeply than almost any other lesson, yet it is a lesson that people resist because failure carries a weight of shame. From childhood onward, individuals are trained to see failure as a verdict, as an indication of inadequacy, as proof that one is not enough. But the reality, revealed time and again in science, in art, in leadership, and in everyday life, is that failure is not a verdict at all. It is a process, a turning point, a redirection, and often the very soil in which opportunity grows. The difference between those who remain stuck in despair and those who find themselves at the edge of discovery lies in the way failure is defined, in the willingness to look past disappointment and into possibility. When people hear stories of great discoveries, they often imagine them as moments of pure genius, as if brilliance strikes once and the world is forever changed. But the hidden truth behind those stories is that most breakthroughs come after countless wrong turns. What looks like genius is often simply persistence, the courage to keep asking questions when the first, second, or even 100th attempt does not yield the expected result. Think about the scientist who notices not what worked as planned, but what happened unexpectedly. Think about the inventor who realizes that the so-called failure is not a dead end, but a doorway to something completely unimagined. That moment of recognition is where true progress takes root. In the world of medicine, these moments are especially powerful. A drug designed for one purpose falters, but in its faltering, it reveals another purpose far more transformative. A treatment thought to be ineffective unveils a new mechanism of the body, teaching researchers something they never knew before. A clinical trial that appears to disappoint opens a window into a condition that had long been misunderstood. Each so-called failure is not just a lost cause, but a set of data, a whisper of insight, a chance to redirect the path of exploration. The story of medical history is littered with examples where mistakes became milestones, where accidents became revolutions. But it is not just science that teaches this lesson, it is life itself. Consider the way personal growth unfolds. A person sets out with ambition, chasing a dream, only to stumble. Plans collapse, expectations fall apart, and discouragement sets in. The natural instinct is to interpret that collapse as the end of the road. But over time, with reflection, many look back on those moments and realize that what felt like disaster was, in fact, the catalyst that set them on a truer path. A job loss pushes someone toward a career they never would have considered, but which fulfills them more deeply. A failed relationship, painful at first, becomes the space in which one discovers independence, resilience, and eventually a healthier love. Each setback holds the potential to become an inflection point, provided it is not defined as defeat but redefined as an opening. Redefining failure requires courage. It demands that the human mind abandon the craving for straight lines and predictable outcomes. It asks people to hold lightly to their expectations and instead lean into curiosity. Curiosity says, yes, this did not go the way I wanted, but what does it reveal? What is hidden here? What have I learned that I would not have learned otherwise? This mindset transforms the laboratory of life into a place of constant experimentation, where no data is wasted, where every wrong turn adds to the map of discovery. Culturally, societies that embrace this way of thinking thrive. Innovation flourishes where mistakes are not punished but studied. Companies that give their teams permission to fail often produce the most groundbreaking products. Leaders who admit to missteps and treat them as lessons create environments where creativity can breathe. History shows that civilizations move forward not because they avoided errors, but because they learned from them. The greatest danger is not failure itself, but the refusal to see beyond it. When failure is seen as final, doors slam shut, possibilities are ignored, and fear takes over. But when failure is reframed as feedback, as opportunity, the world opens wider. The story of progress is filled with those who dared to reinterpret failure. The Wright brothers crashed countless times before achieving flight, but every crash was studied, every broken wing a lesson, every disappointment an opportunity to adjust. Thomas Edison tested filament after filament, each one burning out until at last the light bulb glowed steadily. Each failed attempt was not wasted but stored as knowledge, as a narrowing of the field, as a step closer to success. Their legacy is not that they avoided failure, but that they used it as raw material for triumph. This principle applies not only to grand achievements, but also to the quiet struggles of daily life. A child who fails a test learns resilience if taught to see the failure as a signal of where to grow. An athlete who loses a match gains insight into discipline and focus if the loss is framed as feedback rather than humiliation. A business that launches a product which flops can adapt and evolve if it studies the market's response instead of collapsing in despair. In every sphere of existence, redefining failure opens the door to true progress. The challenge is emotional as much as intellectual. Failure hurts. It bruises the ego, shakes confidence, and can feel like rejection. But when the sting fades, there remains the question, what now? It is in that moment that opportunity begins. To ask what now is to shift from finality to possibility. What can be tried differently? What new direction has been revealed? What unforeseen application lies hidden in what did not work? By asking these questions, the human spirit transforms loss into momentum. One of the most powerful aspects of redefining failure is the way it cultivates humility. Success often feeds pride, but failure reminds people of their limits. Yet in humility lies openness, and in openness lies discovery. A person who admits they do not know everything, who acknowledges that their plan fell short, is precisely the person who is ready to see what others miss. Humility clears the fog of certainty and makes room for surprise, and surprise is often where opportunity lies. Even in relationships, this truth unfolds. Misunderstandings, mistakes, and disappointments can either shatter connections or become the ground on which deeper bonds are built. When partners see failure not as proof that love is broken, but as a signal that growth is needed, intimacy deepens. Friendships that weather mistakes often emerge stronger because they have been tested. Families that learn from failure build resilience across generations. Once again, the key lies in redefining the meaning of failure, in refusing to equate it with the end. On a larger scale, nations and societies reveal this same pattern. Wars, economic collapses, political upheavals, each represents failure on a massive level, yet history shows that such crises often give rise to reform, innovation, and transformation. A broken system, exposed by its failures, becomes the seedbed of a stronger one. A collapsed economy forces new models of trade, industry, and cooperation. A political scandal sparks a demand for accountability and reform. Failure, when faced honestly, becomes opportunity for renewal. What makes the story of failure so powerful is that it is universal. No human escapes it. Every life, no matter how privileged, encounters moments where plans collapse. In those moments, the choice is stark: to sink into despair or to seek the hidden opportunity. The choice is not about whether failure will happen, it will. The choice is about what to do with it, and in that choice lies the difference between stagnation and progress. When failure is embraced as part of the process, fear loses its grip. People who no longer fear failure are free to experiment boldly. They dare to dream, to try, to take risks that others avoid. This daring is the birthplace of creativity. Without it, progress halts. With it, the boundaries of what is possible expand endlessly. Failure becomes not a shadow to avoid, but a lantern lighting the path forward. The surprising truth is that many of the world's most celebrated successes were not planned in the way people imagine. They emerged from accidents, from side effects, from unexpected turns. They were born because someone looked at failure and saw not the end, but the beginning of something new. True progress is not neat, not linear.